Hello, Don here. Welcome to Podiatry Practice Mastery. I'm going to be reading through the next few days this book I put together called The $1,000,000 Practice Formula. I've tried to offer this in a few methods to different types of doctors. I put it into an online course. I put it into this PDF book that I'm going to be reading through, and I really just want people to listen to it and share it with others. So let's get into this. This is going to be the intro chapter here for the $1,000,000 Practice Formula. So, how private practice doctors increase production 200 to 400,000 using systems, procedures, and patient education. The core promise of the book. Most podiatrists work harder each year, but they make the same income. This book shows you how to increase your production by 200 to 400,000 by redesigning the patient visit, building the right support systems, and offering treatments patients actually want. Introduction. 2 podiatrists and 2 different futures. It was 6:20 p.m. on a Tuesday. The waiting room lights were off, but the glow from my computer screen was still bright. I was finishing charts again. That day, I saw 23 patients. The schedule was completely full. I had barely eaten lunch, and I was still typing notes an hour after the last patient left. If you had asked me at that time whether my practice was successful, I probably would have said yes. It was busy. It was respected. I had good patients, but something didn't make sense. At the end of the year, my production would land about 620,000, which was almost identical to the year before, and the year before, and the year before. The strange part was that I felt like I was working harder every year, yet the numbers barely moved. Around the same time, I met another podiatrist at a conference. We started talking about our practices. His schedule looked almost identical to mine. About 22 patients per day, similar patient mix, same type of community, but when he told me his annual production, I almost thought he was joking. He was at 1.4 million. I remember asking the obvious question, how many patients do you see? His answer surprised me, about the same as you. So naturally I assumed he must work longer hours. He didn't. Then I assumed he must be doing more surgery. He wasn't. The difference between his practice and mine had nothing to do with intelligence, skill, or work ethic. It came down to something far simpler. He had designed his practice. I had simply built a job. Like most podiatrists, my training had focused on anatomy, surgery, pathology, and making a proper diagnosis and giving great care. What nobody had ever taught me was how to design a practice system. No one explained how patients' visits create value, how treatment plans affect outcomes, how education influences patients' decisions, and how systems multiply productivity. As with many new doctors, I tried the strategies I knew. I worked harder, I saw more patients, I stayed later. Unfortunately, that strategy has a ceiling. Eventually, your schedule fills up, and once that happens, growth stops. Over several years, I became fascinated with a question. Why do some podiatrists earn $500,000 to $700,000, while others earn $1 million or more? And after studying hundreds of practices, the answer became clear. The difference comes down to 5 things: systems, staff, patient education, procedures, and marketing. When these 5 elements are designed correctly, something remarkable happens. You don't need more patients, you simply deliver better treatment plans to the patients you already see. That improves outcomes, patient satisfaction, patient growth, and surprisingly, it usually reduces burnout. This book is going to show you exactly how to do that. Inside these pages, you're going to learn the 3 numbers that determine your production, how to recognize your most valuable patients in your practice, how to design a $1 million patient visit, the systems that increase production 200 to 400,000 without more patients, and how to build a practice that supports both excellent care and a sustainable career. By the end of this book, you will have a clear roadmap for building what I call the $1 million podiatry practice formula. And if you choose to implement it, you may discover something I eventually learned myself. You don't need to work harder, you simply need a better system. So this was the end of the introduction for this book that I put together, the $1 million practice formula. If you want to get the whole book, you can go to podiatrypracticemastery.com/book, and you'll be able to download the book. as well as an online course if you would prefer the online course version of this. Okay, we'll talk to you tomorrow.